Dr. Lubin, can you tell us about the process by which you conduct an autopsy on a case of possible elder neglect?
We are called by outside agencies, whether it's the police, hospital, who are mandated reporters, first responders, nursing homes, funeral homes, or family members or friends of deceased who might have been involved in a case of elder neglect or abuse. So typically when those bodies come in, we take photos, external photos, as we do with all autopsy or non-autopsy cases. And then an external examination is performed where we, in addition to recording the height, the weight, the eye color, the hair color, any scars or tattoos, we look for any types of injuries or bed sores or pressure ulcers that they may have, where they are located, how deep they are, whether they are infected or whether they have been attended to medically. We also look to see the body habitus of that person to see whether they're dehydrated, whether they are malnourished, or whether they've been properly cared for, whether they are clean or if they are disheveled, dirty, or if they smell. We look for everything that might allude to the fact that somebody was not taking care of them. And so those are things that we do externally. After all that has been recorded, we then do an internal examination where we look for any evidence of disease or that might be related to, say, if they have a pressure sore, like pneumonia. We also look for natural diseases, like if they have heart disease, if they've had a prior stroke, if they have any evidence of, say, dementia.
And why would you look for evidence of dementia?
It's typically people who have dementia that are more vulnerable than those who are a little bit more alert. Typically, a person with dementia isn't able to care for themselves the way somebody who doesn't have it would. They would most likely not be able to remind themselves to eat, to bathe, to go to the doctor, to dress appropriately, to maintain a clean environment, and to maintain their bills. So they lose all of their executive functioning and require the aid of somebody else to help them with their daily living.
Can I ask you how you would determine whether someone might have dementia in an autopsy?
We would do a neuropathological examination whereby we look at the brain, we see how much it weighs, we see whether it's normal size and configuration or if it's shrunken, small for that person. And then we, of course, examine it and we look under the microscope at the tissue sections that we take, which would typically be the hippocampus. And we look for any evidence of neurofibrillary tangles, what we call vacuolar degeneration, anything like that that would indicate that that person had Alzheimer's or some sort of dementia.
And you talked about looking for brain atrophy.
Correct.
Is that consistent with Alzheimer's or something else?
That is very consistent with Alzheimer's, but it also can be seen in other diseases.
Okay, so it's sort of one factor that you might see in somebody with dementia.
Correct.
And the tangles you mentioned, is that consistent with Alzheimer's?
That is true.
What if someone has vascular dementia? Is there any physical evidence you can see of that?
Yes, typically we can see changes, like again, under the microscope, we can look at the blood vessels to see what type of changes they have, whether the blood vessels are hardened, called amyloid change. And we can also see evidence of stroke, depending on how big the stroke was.
If we as prosecutors get a neglect death case and the defense is raised that the victim didn't want medical care, is it possible for you to help us determine whether or not that victim had cognitive capacity to refuse medical care?
That's a very good question. So reviewing all the history and, again, examining the body to see what their body habitus was, whether they had evidence of dementia or not, that can help actually in determining whether that person might have been demented and really should not have been making those decisions for themselves. So yes, it does help. An autopsy examination would help the prosecutor in helping determine whether that person had capacity.
Are there any other physical signs that you find on autopsy that indicate that someone may have had dementia?
Typically, it's all neurological. Again, with the history as well. So if we have a history of, like I said, somebody who's having memory issues, or they were displaying signs of dementia, and we can actually verify that on microscopy, then it's a pretty good bet that that person was displaying evidence of dementia. Where the other agencies come into play, again, they find out whether especially Adult Protective Services. They find out whether who was taking care of this person, whether the caretaker knew that this person had illnesses, whether the caretaker was attentive to the illnesses or the injuries that they were suffering and took them to receive medical care, were changing their bandages, where they were feeding them appropriately, whether it was being documented, whether that person was refusing care or was allowing care to be administered to them. And again, they also find out whether the caregiver was competent enough to be responsible for the level of care that the elderly person required. And so we're not able to make that determination ourselves. And so again, we rely heavily on other agencies to do that part of the investigation and relay that to us so we can help. So that can help us make our determination on cause and manner of death.
Can you give us an example of how you would find cause of death in a fairly typical adult neglect case?
If we had a person that, say, was bedbound or wheelchair-bound, unable to move around very easily without the aid of another person, they had somebody who wasn't being very attentive to their needs. If they left them, say, in bed or on the chair all day long without turning them, without changing their Depends or not, then you would have a person who would essentially urinate on themselves, go to the bathroom on themselves, and they'd be at risk for skin breakdown. And also sitting in one position or lying in one position all day, their bones would be pressing against their skin, which will cause additional skin breakdown. And when that skin breaks down, any type of bacteria that was on their body will then get into that wound, and that wound will then become infected, which would cause that person to get bacterial infection, which can then travel to the heart, the lungs, anywhere it wants to, and cause pneumonia or an endocarditis. And so that is how we relate, what happened to that person. And then you also have to think that you have a vulnerable adult with probable other health issues that puts them at risk for any type of bacterial infection.
And how do you determine whether or not the bacteria that you find, say, in someone with pneumonia is from the pressure sore?
We can do cultures, but oftentimes it's a mixed bacterial flora, and so you'll see lots of different bacteria, but typically you shouldn't see bacteria in the lungs. It should be a sterile place, and so we can do cultures to determine whether the bacteria that we see on the sacral pressure ulcer is similar to the bacteria we see in the lungs.
What other physical signs or symptoms give you concern that a person you're doing an autopsy on has been neglected besides pressure sores?
We look at the body habitus of the person, whether they are, say, malnourished, if they're thin, if they're wasting away. We also look to see if they're properly hydrated, whether they're being given the proper nourishment.
How would you know that?
If you have, say, like a 5'8" person who typically would probably, and it's a female, say she would weigh about 130, 140, 150 pounds, and she comes in and she weighs 95 pounds or 85 pounds, that's a malnourished person right there. And so you want to find out, why are they malnourished? Where were they living? Who was taking care of them? Were they living by themselves and had no family to take care of them? Were they at the final stages of dementia where they just weren't eating, but they were actually receiving adequate medical care? And everything was documented that this person has not been eating, is at risk for choking or aspiration. So we want to know whether, in that case, okay, that person was malnourished. What were they doing? What was the caregiver doing in order to mitigate the lack of nourishment that they were receiving? Were they taking them to the doctor to see what was going on? Were they aware? Were they cognizant of the needs of this person? Were they trying to fix that?
So it's really circumstantial in all of these cases, isn't it?
Correct.
Okay. And what about dehydration? Is there a way that you all can tell whether someone's severely dehydrated?
Yes, typically they would have dry mucous membranes. They would have what we call tenting of the skin when it's checked for what we call turgor. So those are the signs: lack of urine production, sunken eyes. So those are things that we look at.
What about kidney disease? Is that commonly something that happens to victims of elder neglect?
They can go into renal failure. Difficult to determine post-mortem, but yes, that is a risk for dehydration, renal failure.
Any other physical signs that you see besides the ones we've just talked about?
You can have injuries if somebody were, say, beating an elderly person, if they're roughly mishandling them. So those are other things that we look for, any types of injuries not related to pressure sores.
Do you ever see injuries that are consistent with someone having been restrained in some way?
You might be able to see bruising or abrasions on the wrist or on the legs, the ankles.
What advice do you have, Dr. Lubin, for prosecutors who are handling cases of potential elder neglect?
The investigation of elder neglect is very involved. It requires the interaction between medical examiner's office, adult protective services, police or investigating agency, as well as prosecuting attorney's office. Like I said before, no one agency can handle the scope of investigation that is required to ensure that this person was properly being taken care of. And so it requires a central figure in order to collaborate between all of these different agencies and to come together to come up with a cause and manner of death and to adequately prosecute those who are at fault or to exonerate those who were taking care of them and doing the best that they could.